Comedian and former chemist Steve Allen as well. Now we're going to turn our attention to a story that's been a story for a few weeks now, but now the government has actually set up a commission to look into whether or not people from different ethnic groups are dying at different rates of COVID-19. It appears that black people are dying with coronavirus in English hospitals at almost twice the rate of white Britons. But there are stark disparities in ethnic mortality rates across the board. Different Asian groups, different black groups as well. We're going to be talking about that right now with Sir Trevor Phillips, OBE. He's the former chair of the Equality and Human Rights Commission, has now been tasked by the government to actually look into what is going on here and advise into a government review into whether those from black and minority ethnic backgrounds are disproportionately affected by COVID-19. Good morning to you.
Good morning, Julia, and thank you for the Hartley Brewer knighthood, which unfortunately hasn't.
Have you not? I thought you had already.
You must be mad. The Queen knows better than that.
All right then. Apologies. It just sounded right. All right. Let's talk about the actual facts then. Let's go into this. There's been talk for some weeks about this. It was very noticeable, wasn't it, when we saw photographs of the frontline workers, the doctors and the nurses who lost their lives in the NHS in the very early stages of this, and how many of them, the first 10, were ethnic minorities of the doctors, and this raised a lot of concerns that something was happening, which meant that ethnic minorities were being hit harder. Sadiq Khan, the London mayor, talked about the injustice of people from black and ethnic minority communities being hit harder from COVID-19. What is the evidence and why do we think it is the case?
Well, first of all, I should say credit to Public Health England, because behind the scenes, I think they've been bothered about this for some time, and the Chief Medical Officer, I think, has been talking to them for a few weeks. We started discussion with them a couple of weeks ago because we do a lot of work for local authorities and for police, and one of the things that was clearly emerging from the data that we were providing to local authorities is that the incidence of infection lined up very clearly with the minority present in different local authorities. So that was the first sign that there was something not quite right here. Secondly, we did my team, I have a data analytics team in our company, Trevor Phillips. We did an analysis by local authority, which we published on Monday, and it was absolutely clear that there is a relationship between minority presence and infection. But more importantly, even than that this didn't just line up along the lines of poverty or overcrowding. So, for example, the difference between areas where there were a lot of people of African background and Caribbean backgrounds was quite significant. And that's supported by the evidence unearthed by the Times today. It is also the case, both in our study and also the Times work today, that the Bangladeshi population, which is the poorest and most overcrowded, is actually the least likely to be infected by coronavirus or to die from coronavirus. So there are a lot of mysteries here which we do not currently understand, and that is really going to be at the heart of the investigation and review that we're helping Public Health to undertake.
Because that's it. I mean, although at the first glance, I mean, a number of people were saying, "Oh, again, like Sadiq Khan, this is an injustice." The implication being that there was some way that people were being treated differently if they came from different ethnic minorities. But actually, a lot of people were looking at the evidence, and certainly a lot of the experts I've spoken to in the last few weeks on the show have said, look, if you look at the places that have had the biggest outbreaks, London, the West Midlands, very high ethnic minority population. So you're obviously going to see a disparate number of ethnic minorities getting the virus, more likely, as you say, to live in overcrowded homes, more likely to have frontline jobs, the sort of jobs that people have in unfortunately lower economic and social classes. Also, the health, underlying health issues. We know that obesity and diabetes rates, that's a big issue in terms of people's morbidity rates with COVID-19, much, much higher in many black and Asian groups than across the white population as a whole. But then, as you point to, the disparity between different Asian groups and different black groups, it makes it much more complicated. And as you said, the fact that the Bangladeshis known to live in overcrowded houses, being the poorest demographic, and living in many large population in East London, very overcrowded conditions, not dying. Is there a lot of evidence that this virus, like any other coronavirus or any other virus, does actually tackle the different have an effect on different genetic makeups? And we know there are some diseases like sickle cell, which they affect different races differently. Is there any evidence that viruses do actually hit people of different races differently?
There is some suspicion, and I'm not a biomedic, so I'm a stats guy really. I'm a information geek. There is some suggestion by the doctors that there is something like that going on, but I have to say that the statistical evidence doesn't really support that. What we normally talk of as racial groups, like South Asian people or black people like me, are in scientific terms described as phenotypes, people who look kind of pretty much the same. The problem we've got with what we're seeing here is that within phenotypes, like black people, there are big differences according to where people come from. And this is not just a British issue. There's some evidence that we've seen coming out of Sweden, which shows that there are quite big differences between different African groups. There, the big losers, as it were, or the big risk is amongst Somalis. What we think is probably more likely to be true is that what we're seeing are the effects of, first of all, different age profiles. So, for example, Caribbeans are much older in this country on average than Africans. So the Times data today says that Caribbean people like me are 69 out of 100,000 mortality rate, whereas Africans are just 27, i.e. people like me are 3 times as likely to die from this as at the moment as our African cousins. What we also think is probably, if you like, a suspect factor is occupation. What is probably undoubtedly true is that some ethnic minority groups work in areas where they are regularly in contact with random selections of the public and large numbers of the public. So Caribbean people who work in transport, for example, for London Underground and so on, constantly at risk of catching the disease. That's what we think is happening, but over the next few weeks we're going to be examining some of these patterns much more closely. And, like any scientist, I think the truth of the matter is we can't give an explanation right now. We have to be prepared to be surprised by what the evidence tells us. And I would say that there are 2 lessons out of this. Don't jump to conclusions, and unfortunately some of our political friends, that's what they specialize in. It's not helpful here. And secondly, one of the lessons we should learn is that the information regime that's imposed on this country, which essentially forbids the collection of ethnicity data, has put us at a massive disadvantage here. We ought to have this data at our fingertips. Right now, we don't.
I'm surprised that we don't. I can't think I've filled in a form for anything in recent years, even if I'm using the local library, that doesn't ask my ethnicity.
Yeah, but you're not allowed to keep it. Information Commissioner.
Why are they asking it then?
Pardon?
Why are they asking for it if they're not keeping it and doing it for something useful?
Well, there are different reasons, but this is not the fault of your local authority. The Information Commissioner's Office defines ethnicity, unlike gender, as sensitive personal data. So your local authority isn't really allowed to keep a flag, if you like, on your library ticket that says you are what you are. And that means that when we want that information, we actually have to come back and ask you, whereas we don't have to ask that about gender. And as a consequence, today, we literally cannot really understand any of these patterns without going out to do some new research. I think one of the big lessons we have now is that we've been far too sensitive about these issues of race, and it's now put us at a massive disadvantage and put at least one big section of the community at deep, deep risk.
Just finally, you did say that we shouldn't jump to conclusions, and you said it's not helpful. The conclusion, I'm going to bring this back up again because I was very angry about this. Sadiq Khan, the London mayor, saying that we need to tackle this injustice. He used the word injustice, that ethnic minorities were dying at a higher rate than white people. As you pointed out, Bangladesh is actually dying at a lower rate than white people. It affects different ethnic groups differently. But do you think that is a case of someone jumping to conclusions? Was it helpful for Sadiq Khan to refer to this as an injustice?
Well, you're not going to take me down that road, Julia. Here I'm working as a scientist rather than as somebody in politics. All I can say is I suspect that the mayor was working with the information and advice that he had been given, and it was certainly incomplete, and I suspect in some respects incorrect. And I would just advise everybody in the public domain to just think before they speak on this particular issue, because not only is it, of course, damaging in terms of public health, but we know if we start to get into a situation where we talk about different ethnic groups in a way that is incorrect, we know that the effect of that will be politically and socially divisive, and we just don't need that at the moment.
Absolutely not. Trevor Phillips, thank you very much for joining us. He's got an OBE, not a knighthood. Former chair of the Equality and Human Rights Commission, looking into the data on this very important topic. Let's bring in Steve Allen, who's been listening to that. He's a comedian and a former